Hi, it's Dr. Grunch. I'm going to do a video explaining the postoperative expectations and recommendations after having an anterior lumbar fusion. That's also called an ALIF. Basically, an ALIF is an incision where we come through the front of your abdomen to access your spine. That's done by myself and Dr. Reeves, who is a vascular surgeon. So I will send you a separate video kind of explaining what we found during your particular surgery, but this is a video kind of explaining the postoperative expectations and my recommendations after you've had this surgery. We typically do this surgery at L4-5 or L5 and S1 or both, and the incision will depend on which levels we're accessing. L5-S1, we typically do an incision kind of straight across, like a C-section kind of incision, and if we're going to L4 and L5, we do an incision up and down like this. Basically, the incision will be closed with glue. You can take a shower in 24 hours. The dressing that's on there, you can peel off the first time after you take a shower. The abdomen may hurt. It usually hurts a little bit more off to the left side because that's typically where we access the spine into the retroperitoneal cavity, and even pain down into the groin or left leg can sometimes happen, and that's normal. And if it's severe, you need to call the office and let me know. Keep an eye on your incision. If there's any swelling, redness, pus, or anything like that, you need to let me know. It's normal to have some redness, but anything that looks concerning or hot, any fevers greater than 101.5, my office needs to know. We typically do ask you to be cautious about coughing really heavy or straining really hard for 6 weeks so you don't get a hernia. Anytime you cough, it might be beneficial to have a pillow or something that you can place on your belly to kind of help protect that area when you cough. Sometimes we'll give you an abdominal binder. If we give you one, and we want you to wear that for the first 2 weeks. I usually do also fit you with a brace, a back brace, and you'll wear that anytime you're up and moving around until your post-op visit. You don't need to wear it to sit, to shower, obviously, or to sleep, just up when you're up and walking. It's normal to have back pain after the surgery. Even though we came to the front, you might have muscle tension and stiffness in your back and sometimes even down your leg. If you have any questions about any of your postoperative pain, just call the office. I usually prescribe a pain medication that you can take as needed, as well as a muscle relaxer. You want to avoid medications like ibuprofen or anti-inflammatory medicines for the first few months after having a back fusion, because there is some data that suggests that this may impair fusion, and we don't want to do anything that may jeopardize the fusion. You may be prescribed something called an external bone growth stimulator. That's a device that will help your fusion manifest. You'll receive a phone call from that company. EBI is the name of that company, usually a few weeks after your surgery, to see if your insurance company is going to cover that device. I recommend that you wear that as much as possible for the first 9 months after your surgery, because that can improve the outcomes of your fusion. If you use nicotine products, we would have had you quit before surgery, and I strongly encourage that you do not resume any nicotine products, as it could also impair your healing process, which we don't want to have any problems with. Other postoperative things that you need to keep an eye on: any swelling of your legs, you need to let my office know. We do retract the iliac vein during the surgery, and so there's a slightly higher risk of having a deep DVT or a deep vein thrombosis. So if you have any abnormal swelling of one or both legs, please let my office know so we can look into that further. You'll have a postoperative visit at about 4 to 5 weeks out from surgery. That will be arranged, and you'll see one of my physician assistants at that visit. Usually we'll obtain x-rays at that visit, but if you have any questions or concerns before that, please reach out to us. Occasionally, when we do an anterior surgery, we will also do a posterior surgery, and if you did have that done, I will send you another video on that.